And for more on the summit and the Roll Back Malaria program in Nigeria, I have with me in the studio Dr. Adekunle Charles, the Chief Executive Officer for the Roll Back Malaria Partnership. Thanks for joining us.
Thank you very much.
And let's begin. What are the specifics now? New domestic financing mechanisms that will be implemented to ensure the big push is sustainable and not just donor dependent, because we see donors are now taking back their donation to the countries like the US.
No, thank you very much, and that's exactly why we are here today, to talk about the next steps. What is it about financing? As you rightly said, we don't have the luxury of the funding that we had in the past. We saw what happened at the beginning of this year, and that's why under the leadership of the Coordinating Minister for Health and Social Welfare, he is really driving it and saying we need to look inwards, we need to look at resource mobilization, we need to look at domestic resource mobilization, but we cannot do it alone. And that's what the big push is about. It's about bringing the various stakeholders together, working with the private sector, working with various ministries, working with the communities to really ensure that we own the problem and we have a solution to the problem.
Okay, about the vaccines, we've had trust deficits before to vaccines in Nigeria, and we've witnessed logistic barriers in previous similar initiatives. And some experts in the health sector say it should be holistic, and the approach should be holistic, like nutrition, environment, diet, and also acceptability of the vaccines from Nigerians. What reaction have we been able to get from stakeholders?
I mean, vaccines is one of the tools, one of the many tools that we have in terms of the fight against malaria. It's not the only tool, but it's one of the many. And we're saying that we need to really look at subnational tailoring to see where does it make sense to deploy vaccines, which communities are going to accept it. What we do know globally and in Africa is that many countries have started rolling out the vaccines and it's being accepted. But really key is the vaccines alone is not going to cure malaria. We need multi-dimensional interventions. We still need the bed nets. We still need to clean our environments. We still need to spray the houses. So it's really a combination of all this that we need to see and use to ensure that we drive down the burden of malaria.
Okay, I reckon the big plan for the big push is to leverage the private sector for key interventions within the framework of this new drive that you're implementing. Does this include utilizing them as patent medicine vendors to solve the last mile distribution problem for tests and treatments, not going to the hospital? There are places where you can just go have the tests and get treatment.
Certainly, and that's what we're saying around the big push, that we need the public-private partnership. Government alone cannot do it. Government is trying its efforts, but we need to bring the private sector on board. And we need to look at the value chain altogether to see where can the private sector plug in and in which communities, in which states, etc. So this is the beginning of a dialogue. This is the beginning of a new thing, and that's why we're saying the big push is what we all need. We need to bring all the various stakeholders together to ensure that we can collectively drive down the burden of malaria.
This is huge, actually, and from the report, we've seen countries that have been able to conquer malaria in their countries, like the Seychelles and all that. So what lessons is Nigeria taking from that?
The lessons that Nigeria is taking from what we've seen from other countries. We had Cape Verde there, which was certified in 2024. In Africa, we have Egypt that was certified as well. The lesson there is that it has to be an integrated approach. We cannot look at malaria elimination just from a health perspective. We need to look at it from a developmental perspective. We need to bring the Ministries of Agriculture in. We need to bring the communities in, Ministry of Gender, Ministry of Development. Everybody needs to get on board, and that's where we're saying the whole of society approach is needed. That's what we're learning from other countries. We need to strengthen our surveillance. We need to strengthen our data systems. We need to strengthen our coordination mechanisms. And we need to ensure that as much as possible, we also have accountability mechanisms, accountability vis-a-vis the communities, accountability vis-a-vis the government, but accountability for all of us as a whole. So it is possible to end malaria. We've seen it on the African continent, and we're quite inspired with the new tools that are coming out. You've spoken about vaccines, but there are many other tools that will come out in the coming years that we believe will be revolutionary in terms of bringing down the burden of malaria on our continent.
I wish you a success story in this one. I hope Nigerians will be able to accept the vaccines and roll back malaria. That is very, very important, especially in the area of maternal mortality. Dr. Michael Adekunle Charles, the Chief Executive Officer for the Roll Back Malaria Partnership, we thank you so much for your insight and time. We appreciate you.
Thank you very much.
Thanks for coming.